Chapter 14 Health Psychology Stress, Coping and Well-Being Shanthan C. Sims. Introduction Psychological Disorders and Their Treatment. The purpose of this chapter is to explore the definition and classification of psychological disorders, the factors that contribute to their development, and the various treatments that are available, and briefly shows how it is related to medicine. In this chapter, a brief description of the following is discussed: stress, health psychology and medicine. Psychological factors affecting health. Interaction with physicians in relation to health. Psychological aspect of illness and well-being. Promoting health and wellness. Definition and classification of psychological disorders. In Chapter 14 of the 15th edition of Understanding Psychology, by Robert S. Feldman, health psychology is discussed as a field that bridges the gap between medicine and psychology. Health psychology focuses on the interactions between psychological factors and physical health, and how these interactions can affect an individual's overall well-being. Health psychologists work closely with medical professionals to understand and address the psychological factors that may contribute to physical health issues. For example, stress and anxiety can have negative effects on the body, such as weakening the immune system and increasing the risk of cardiovascular disease. Health psychologists may work with individuals to develop coping strategies to manage stress and anxiety, which can have a positive impact on their physical health. Overall, health psychology serves as a bridge between medicine and psychology by recognizing the interconnectedness of physical and psychological factors in promoting health and well-being. Anxiety disorders. Anxiety disorders are characterized by excessive and persistent fear or anxiety. Symptoms may include panic attacks, phobias, and obsessive-compulsive disorder. Treatment may involve therapy, medication, or a combination of both. Stress is a psychological response to challenging or threatening situations, and chronic stress can have negative effects on physical health. For example, chronic stress can weaken the immune system, increase blood pressure, and contribute to the development of cardiovascular disease. Mood disorders. Mood disorders are characterized by extreme and persistent disturbances in mood, such as depression or bipolar disorder. Treatment may involve therapy, medication, or a combination of both. Personality disorders. Personality disorders are characterized by inflexible and maladaptive patterns of behavior and thinking. Treatment may involve therapy, such as dialectical behavior therapy, that focuses on changing thought patterns and behaviors. Certain personality traits have been linked to physical health outcomes. For example, individuals who exhibit high levels of conscientiousness tend to have better physical health outcomes, while individuals who exhibit high levels of neuroticism tend to have poorer physical health outcomes. Schizophrenia spectrum disorders. Schizophrenia spectrum disorders are characterized by a range of symptoms, such as hallucinations and delusions. Treatment may involve medication and therapy. Factors contributing to psychological disorders. Biological factors, such as genetics and brain chemistry, can contribute to the development of psychological disorders. Environmental factors, such as trauma and stress, can also contribute to the development of psychological disorders. Cognitive factors, such as negative thought patterns, can also contribute to the development of psychological disorders. Role of stress and trauma. Stress and trauma can contribute to the development of psychological disorders, such as post-traumatic stress disorder. Effective coping strategies, such as social support and relaxation techniques, can help individuals manage stress and trauma. Therapies for psychological disorders. Various therapies, such as psychodynamic therapy and cognitive behavioral therapy, can be effective in treating psychological disorders. Group therapy can also be effective, as it allows individuals to connect with others who are experiencing similar issues. Medication and other biomedical treatments. Medication and other biomedical treatments, such as electroconvulsive therapy, can be effective in treating psychological disorders. However, finding effective treatments can be challenging, as different individuals may respond differently to the same treatment. Stigma surrounding mental illness. Stigma surrounding mental illness can prevent individuals from seeking treatment and can contribute to feelings of shame and isolation. It is important to address and reduce stigma surrounding mental illness. Interaction with physicians. Research has shown that positive interactions with physicians can have a significant impact on physical and psychological health outcomes. For example, patients who report positive interactions with their physicians may experience reduced anxiety and improved adherence to treatment plans. Conversely, negative interactions with physicians can lead to increased stress, dissatisfaction with care, and poorer health outcomes. The quality of communication between patients and physicians is a critical factor in shaping patient outcomes. Effective communication involves not only providing medical information, but also addressing patients' emotional and psychological needs. For example, physicians who exhibit empathy and warmth may be more successful in building trust with their patients and promoting positive health outcomes.
Sense of well-being. A sense of well-being refers to a subjective experience of feeling good about one's life and functioning well in daily activities. Well-being is influenced by a variety of factors, including physical health, social support, life satisfaction, and positive emotions. Research has shown that individuals who have a strong sense of well-being tend to have lower rates of depression, anxiety, and other mental health disorders. They also tend to have better physical health outcomes, such as reduced risk of cardiovascular disease. Practicing self-care, such as getting enough sleep, eating a balanced diet, and engaging in physical activity, can also promote a sense of well-being. By taking care of oneself, individuals can feel more in control of their lives and better able to cope with stress and challenges. Overall, a sense of well-being is a complex and multifaceted concept that is influenced by a variety of physical, social, and psychological factors. By promoting positive relationships, positive emotions, a sense of purpose, and self-care, individuals can cultivate a stronger sense of well-being and enjoy better overall health outcomes.
Multidisciplinary approach to mental health care. A multidisciplinary approach to mental health care, involving mental health professionals, medical professionals, and support networks, can be effective in promoting recovery and well-being. Exercise. Regular physical exercise has numerous benefits for physical and mental health, such as reducing the risk of cardiovascular disease and improving mood. Health psychologists may work with individuals to develop exercise plans that are safe and effective. Diet. Eating a balanced diet that is rich in fruits, vegetables, and whole grains can have positive effects on physical health outcomes. Health psychologists may work with individuals to develop healthier eating habits and address factors that contribute to unhealthy eating patterns, such as stress or emotional eating.
Sleep. Adequate sleep is essential for overall health and well-being. Health psychologists may work with individuals to develop healthy sleep habits and address factors that contribute to poor sleep, such as stress or insomnia. Stress management. Chronic stress can have negative effects on physical and mental health. Health psychologists may work with individuals to develop stress management techniques, such as mindfulness meditation or cognitive behavioral therapy. Social support. Social support from friends, family, and other sources can have positive effects on physical and mental health outcomes. Health psychologists may work with individuals to develop stronger social support networks and address factors that may contribute to social isolation or loneliness. Conclusion. Overall, promoting health and well-being involves addressing both physical and psychological factors. Health psychologists can play a crucial role in helping individuals develop healthier habits and coping strategies to achieve better overall health outcomes. Psychological disorders are complex and can have a significant impact on an individual's life. It is important to address both physical and psychological factors in promoting health and well-being. References: Cohen, S., Janicki DeVerts, D., and Miller, G. E., 2007, Psychological Stress and Disease. JAMA, 298, 14, 1685–1687, Diener, E., and Seligman, M. E., 2004, Beyond Money, Toward an Economy of Well-Being. Psychological Science in the Public Interest, 5, 1, 1–31, Dweck, C. S., 2017, Mindset, The New Psychology of Success. Ballantine Books. Fredrickson, B. L., 2001, The Role of Positive Emotions in Positive Psychology, The Broaden and Build Theory of Positive Emotions. American Psychologist, 56, 3, 218–226, Gatchell, R. J., and Rawlings, K. H., 2008, Evidence-Based Approaches to the Treatment of Chronic Pain, a Review of Recommendations. The Journal of the American Society of Anesthesiologists, 109, 1, 40–47, Seligman, M. E., 2011, Flourish, A Visionary New Understanding of Happiness and Well-Being. Simon & Schuster. Selly, H., 1974, Stress Without Distress. Lippincott Williams and Wilkins. Taylor, S. E., 2011, Health Psychology. McGraw-Hill. Thowitz, P. A., 2011, Mechanisms Linking Social Ties and Support to Physical and Mental Health. Journal of Health and Social Behavior, 52, 2, 145–161, World Health Organization. 2014, Social Determinants of Mental Health. Geneva, Switzerland, author.